We've created this obscene environment where people serve private profit. We need to turn it around. The reason for business is to serve humanity. The very DNA of business has got to be about creating health and wealth and resilience in communities around the world. That's the bottom line. When I got out of college, my first job was as a travel writer. And after 2 years of eating and drinking my way around the world, a college friend said to me, "Gary, you're a guidebook writer. Why don't you write a guidebook to toxic chemicals?" We're talking about a guidebook for people that are living in these contaminated communities so they can organize their neighbors, so they could use the media, so they could hire lawyers if they need to, so they could access government databases, so they can get more political power. At that time, the Union Carbide chemical disaster had happened in India, where thousands of people were killed by an explosion from a pesticide factory, and because these people were expendable, they didn't matter. In America, people were worried, could that happen in my neighborhood? And so I jumped into that movement and worked on this book that became the book Fighting Toxics. This is an industry that's grown up around a culture where there is no moral barometer, a completely immoral industry. And the hospitals were the largest source of dioxin emissions in the United States, and a really significant source of mercury emissions. And these were two chemicals that were the kind of poster child chemicals for those low dose exposures. We said, how are we gonna turn this whole society around from its addiction to toxic chemicals if the very institution in the country devoted to healing is itself a major polluter? We gotta transform healthcare. And so that was the turn that created Healthcare Without Harm and moved me on this journey to try to transform the healthcare sector from being a major polluter to being a major force for healing and regeneration. Most healthcare professionals haven't been educated about environmental health issues, the connection between climate change and health, the connection between toxic chemicals and health, the connection between food and health, the connection between housing and health. And so what Healthcare Without Harm did was to bring those issues to the doorstep of the healthcare sector and said, you need to address these. It can't just be about treating sick people. We need to move upstream and treat people and address the conditions that are making people sick in the first place. Clean air, clean water, good food, safe housing. We need to help people make this difficult transition from a really sick society to something that's healthy and sustainable. Other than that, it's no big deal, you know? Otherwise, we're just fine. Everything's cool. In order to solve climate change, we have to price carbon. We have to put a price on our use of fossil fuels that reflects the full social and environmental costs of that addiction. We need to internalize those costs. They're all being externalized now. So there needs to be a high price on carbon to help incentivize this transition to renewable energy economy. It's fundamental to making this change happen. We've created a purchasing cooperative that has some of the largest healthcare systems in it, and we're working with them to design specifications that can drive their purchase of food that doesn't have pesticides in them, drive their purchase of building materials that are safer for the occupants, buying medical products that don't have some of these toxic chemicals leaching into patients. If we can have compassion for all beings, all species, not to see anybody as the other, that's incredibly powerful idea. You can give people facts all day long about the problems and all the crises, but I don't think it moves people. I mean, if it did, we would have solved climate change a while ago. We've known scientifically that it's a problem. But we need to move people's hearts. We need to personalize it. And then the science and the technology can add on to that. We need to give people the heart connection, and then the science, and then the path forward. And then we'll build a global movement.